The next patient is case number 20, a 68-year-old man with a small atrial septal defect. It was diagnosed in 1990. Now he has a moderate pulmonary hypertension and arterial hypertension. ECG showed atrial fibrillation, a right bundle branch block, and a left anterior hemiblock. TTE showed the atrial septal defect type 2 with a diameter of about 10 mm and left to right shunt. Both left and right atrium and the right ventricle are dilated. The ejection fraction is 69% with a moderate left ventricular hypertrophy. In addition, there is a tricuspid insufficiency grade 2 with moderately increased PA pressure.
That's good. So basically what we did here, this axis was somewhat a little bit difficult in this gentleman. We put two sheaths, 11 French and 10 French via two separate punctures. The 11 French for the ICE catheter. Horst has the 11 French AccuNav catheter. This is the four-way tip articulation, and then the other sheath for the device. So this is the home view, as you can see, showing the aortic valve, the tricuspid valve, and put the color Doppler there. Put color Doppler. As you can see, the TR is pretty mild, TR is not much. So then we're going to get the septal view. So the septal view will show you the aortic valve, and now we're going to come to the septum here, and there is the sheath across the defect. I lock it there, and now what we're going to do is turn the color Doppler there on the sheath. There is the defect, and before we put the sheath, the defect measured 13 millimeter by color Doppler. Freeze it there and measure the defect when you see the color Doppler. Go back, go back, go back. Yep. So we measured 12.2, 13 millimeter, two different measurements. And we decided that we're going to use a 15 millimeter Occlutech device.
Okay, here you go, chaps. You can see the device. You're looking at the left atrial aspect, and you notice the immediate discerning feature is the lack of the welded axle on the left atrial side. If I turn it over, you can see there is a relatively low profile screw hub on the right atrial disc. And in profile, the device looks very nice, as you can see.
So there is the device. Let me just finish this and we can take some questions. So we are at the tip of the sheath. As you can see, we're going to bring the sheath out of the pulmonary vein. It jumps out there. And what we're going to do here, we're going to deploy the LA disc. So I'm going to do a quick cine here and just deploy the LA disc. We're near the vein. There you go. So you can see by echo, we're far in the septum. So we're going to bring it towards the septum there. Show them big picture echo. There you go. We are close to the septum. Yep.
That's very nice intracardiac echo. On the fluoro, Omar's point is correct. You do see, unless I'm seeing something else, coronary artery calcification.
But calcification does not necessarily mean, significant disease. So I'm going to come towards the septum here. We're close to the septum right now. And what I'm going to do here is basically deploy the rest of the device. We just, I don't have much room here. I'm going to remove this here. So we're close to the septum. So we're going to deploy the waist here and cross the defect right there. Can you show them big picture echo? So you can see the device is capturing both septum secundum and
color, please,
and septum primum. There's a flow within the device. So this is the SVC view here. So you can see the SVC right there. I'm going to get the short axis by rotating the AccuNav catheter clockwise rotation until it's above the tricuspid valve. Go ahead while we're... So there is your aortic valve right here.
Hey, yep. Did you balloon size this defect?
No, we did not balloon size. Over the last 3-4 years, we stopped balloon sizing, except when we are proctoring or training somebody. But quite honestly, for the most part, we do not balloon size the defect. Good. You can see now by fluoro the profile of the device parallel to the atrial septum. So we're going to do cine here and just basically release the device right here. Released it. You can see it changed a little bit. We don't do the wiggle really. Show them now full image echo. And you can see the full image echo. The device is sitting nicely across the atrial septum. There is no residual shunt, and the result is excellent. So really, we don't do the wiggle anymore.
In a patient with absent aortic rim or other rim, Ziad, would you still not do a wiggle? I mean, in this case...
No, I don't do the wiggle at all. I rely mainly on echo images if I think that the device sits in good position. And, you ascertain that by the echo and by fluoro. The wiggle does not really do me much at all, in terms of reassurance. The procedure is done. The patient, will leave, and aspirin and the Plavix. Yep.
Thank you very much for that nice demonstration.